You're welcome.
Thank you.
My name is John Bosco. I'm one of the instructors, right? What's your name?
My name is Mohammed.
Mohammed. All right. So, unfortunately, I don't know, you were not able to make it yesterday, so we started having some conversations and we had to stop. So, we continue from where we left off. I hope everybody had a good time yesterday, right? Were you able to read on your own at home? Okay. All right. Please, it is not enough here. You still have to sit down and read. Okay. That will do the trick. If you have any questions, you can ask for what we did yesterday. If you have any question that is bothering you, if I understand some of you have attempted the quizzes after the chapter, some of you have started. How did you say it? You were able to answer the questions? Yeah. Thank God I'm able to do something. All right. Great. So let's continue from where we're talking about. So we're talking about environmental control conditions. For our online friends, are we there?
Yes, we here.
Okay, good. So we are continuing. Anybody with a question?
Not yet.
Okay, silence means everybody's good. So we continue from where we left off. We are talking about environmental control. We say that in every department or every section of the department, they have we take records of the humidity, we take record of the temperature, we take record of the quality of air. Okay. In deep content, for example, because you are going to be dressing so heavy, the temperature there is low. Because you are the gowns are going to warm you up. Imagine it is summer and you are in those clothes. You're going to be sweating like somebody says, like quote unquote, a pig, right? So the temperature in the content is different from the temperature in prep park. The temperature in prep park is different from the temperature in the storage room. So all of them have their temperatures. We'll see some of these temperatures along the line. And engineering department, that is the people who have been hired also to be in charge of the hospital buildings. They are in charge of electrical, the plumbing. We call them engineering department. They control this. But if they have monitors in the department that we have as CSPD techs, we have to also check if it's too cold. We call them and say, hey, it's too cold, we are freezing. They add the temperature a little bit. If it's too hot, we tell them, hey, it's too hot, we cannot breathe. They lower the temperature for us to do that. That is their work. So let's go. Okay, storage area. So we have looked at the prep and pack. Sorry, decontain. We have looked at prep and pack. We have looked at sterilization. Now we want to see storage area, where we store the items that we process. Supply area of central service, dedicated to storage of central instrument or sterile instrument and supplies. So we store supplies. So if you look at the picture there, on your right, those are, let me see if I can get the cursor to work. Yes. Yes, this section are trays that we have that have been sterilized and are in the storage room. The extreme right is also instruments that have been sterilized, but they are not in the container like what we have here or what I showed you yesterday. These are top pouches, those that are coming in this plastic paper forms. Okay, they are stored in those blue bins. Okay, that is how we store them in each of the hospitals that you may be working with. So we have the container ones, we have the wrapped ones. Unfortunately, I don't see any of the wrapped trays. Maybe along the line, we'll see some of the wrapped trays. So now we keep says separate areas for removing supplies from what shipping containers. So when we receive supplies, for example, this comes in a box. The wraps come in a box. Other supplies that we use, the logs, the filters, they all come in a box. The box has been exposed to outside environment. So from some of the items are coming from maybe Germany, some of them are coming from Canada, some of them are coming from Spain, some of them, wherever it's coming from. This has been sitting sometimes on the ship for hours, for days, for months before it gets here. So the box is what? Infected. So we assume, we just say that the box is not good. So you cannot go and keep the box in the storage room. So we have to have a dedicated space whereby we break these boxes and then we remove the items that are in there and then we send it to the storage room. The items in there are not exposed to the outside environment, so they are presumed to be what? Clean and sterilized or safe to be stored in the storage room. Does that make sense? Right. So that's what that point is talking about. Major activities: receiving, storing, and dispensing supplies. That's what it is. So that area we receive, we store, and then we dispense. When a department calls for something, we go to the storage room, take it, scan it out, and send it to them. Or log it in whatever book that we have to keep inventory of what is going and what's coming, and then we send it to them. All of that you get to know once you begin to work over there. Servicing the OR. Use of case cards. Maybe the next picture we'll see case cards. And then, so case cards means it's just a metal box that's, you pick whatever they need for that particular surgery and put it there and wheel it to the room where it's going to be needed for the case. So whatever the doctor comes, they open, they pull out everything, set it up, and then boom, they start with the case. That's what I call a case card. All right. Some hospitals, CSPD is in charge. Other hospitals, CSPDs and technicians are not in charge. My hospital, for example, my technicians are not in charge. We don't do pick cases. The OR has a staff that pick the cases. So our job ends once the tray is in the storeroom. That is the end of our job.
That was good to see. I wrote one answer in the questionnaire.
Okay.
That if you are done with sterilizing everything, are you supposed to take it in? And I said, I click on you because I thought that our job ends.
No. It depends on the hospital. All right. Yeah. So the job actually some maybe let me say 70% of the hospitals we do the picking. CSPT staff do it. But my hospital, for example, is an ambulatory. It's a small place, so they have somebody who is in charge.
So in actual maintenance, our work ends where?
Your work.
Yeah, but you said that some people don't allow you to take it.
According to hospital protocol that you are saying,
Yeah.
I have to know this is where my work ends.
So
if I go to any hospital, the protocol is telling me to do this. I know it's extra thing I'm doing.
no.
It's
It's part of your job.
So where does your work ends?
So that's why I said it depends where you are working. Okay. So that's why I don't want to say that your work ends at storage room. That is if you're working in my hospital, your work ends at the storage room. Even then, in case they are looking for something they cannot find, they will come ask you for help. So you still have to, because we store it over there, so we know where you can find the items. So when they need help, they say come. But in some hospitals, when they hire you, your job includes picking the case and giving it to them in the ward. So that's why I don't want to categorically say that our job ends here. It depends on where you are going to work. Okay? Yeah. Sometimes some hospitals, they even allow you to go and see what the doctor is doing in the room. so that you know that, oh, okay, this instrument, this is how it is used, this is how, if it comes, I have to clean it. Sometimes I do send my staff to go and watch how the doctor is using it or doing the surgery so that they know how to clean it. Because sometimes they don't know. They don't know how the instrument is used, so they don't know what to look for in cleaning it. But if you know how it is used, you go and see how it is used, how they use it, maybe suction to suction blood, and you see, you know that when you get suction, you need to flash it because blood and tissues could be stuck in there. All right? You were going to ask something?
I wanted to ask when they are doing surgery.
Yeah.
I think the instruments they count them, they know the number of the instrument that they are using.
Yeah.
So after the surgery, they also count it and see that the same number we get after the surgery.
Mm-hmm.
So in this case, if maybe I can't see the 6 counts, then you leave some in the patient's body.
Mm-hmm.
So if something like this comes, do the SPD that they will be asking for them, and then scrap is working with the doctor.
What is your problem, madam?
Some of is an instrument.
No, just whatever comes in the content is what you work with. The person in prep who will say something is missing, they find a replacement to put it back into the tray. If we have one, if we don't, they inform the manager to place an order for it to be purchased. Whether they left it in the patient's stomach, that is worst case scenario. We don't want it to happen, but it can happen. It has happened before.
Yeah.
All right, it can happen, but it's not common lately. But it has happened before. I've worked in a hospital where it happens. Yes. This one, the straight one, we call it malleable. Was left in the patient's one.
No,
So this one, this straight one.
Normally, it's a season and gauze.
Gauze is the most commonest that should be left. But one time somebody went home with this straight one. The person can bend.
Hey.
And then they went back to take X-ray and they saw that it was left there. So it does happen. But that is not your job. Your job is to clean it. If you are decontaminated, the person prepping it will say, hey, I didn't get this. If it is a one-of-a-kind instrument, one-of-a-kind means that it's not easy to find it, it's not common, it's not cheap, it's not lying anywhere. It's a special instrument. Then the manager has to be informed immediately so that the manager will follow with the OR and find out how come it went to the room and then come back. All right? Sometimes I'm just telling you the truth. My boss doesn't even know that. My hospital, if they just see me in the room, they're in trouble. They know that I'm coming to them. It means something is missing before I go to the room. If I go to the room, everybody is shaking. Am I in trouble? That's what I asked me. I said, if you know you did something wrong, then you are in trouble. If you didn't do anything wrong. Sometimes they tell me, no, it didn't come. I said, it was in there. Because if it was not there, you couldn't have done the case. So I begin to question them. Before they arrive, they say, oh, I didn't see the trash. They go and look into the trash. Bring it back to me. All right? So it happens. But if they left in the patient, we pray it doesn't happen. But it will happen. But that is not your job. Your job is to clean. They are supposed to cross-check. Yes, they do the first count when they open the tray. And then when the case is over, they do the count to see whether everything is back. Okay? Have I answered the question? Right. So that is what we are supposed to do: receive, store, dispense for the case card, central storage of surgical supplies in the department, and dependable system to supply our items. So some places they use some systems such that as instruments go out, they have a way to track it. Okay, they know that it prompts them automatically that we're running low on this, we're running low on that. So management is able to get alerts, like just like the way somebody sends you a text message or a WhatsApp message, you get alert on your phone. Yeah, they have systems, very, very good hospital. They have systems like that you are able to monitor, and you are able to make sure that you don't run low of any items that you are dispensing. Procedure scheduling. We saw yesterday that scheduling is done at a central location. So people go, testing is done, they pick a date, they give you instruction what to do, they program or they schedule you, and then it goes into the system. Everybody sees who is coming for what surgery at a certain time. So scheduling is done at a very centralized location. Now, when scheduling is done, then we look at the doctor's preference card. What is the doctor looking for? Those are the things that we use to put the trays together for the case. That's what he's talking about, gathering instruments and what supply. Collect and assemble specific items needed for upcoming work procedure or department work use. So the doctor, you always, when you go there, you get preference card. That is the doctor's, what the doctor needs is what they call preference card. Or the doctor's the surgeon's list. It's the same thing. So you go, yes, you go, the doctor's list has supplies and instruments. The supply parts, depending on the hospital, again, sometimes the supply part is not under our control. It's under materials management. So they will be responsible for the supply part. But we are responsible for solely for instrumentation. So when you pick the doctor's list or the preference card, you only go and look for the heading instruments. Once you see instrument, everything that falls under instrument will have to come from your supply of your storage room. That is what you pick for them, and that you're done. The rest of the stuff is not your business. But you will find the OR coming to ask, is this from them? Sometimes they don't know that it's a supply item. They think it's something from Central Sterile Processing. It's kind of like, do you have this? Then you tell them, no, this is not from Central. It's from materials. So they now know where to go look for it. All right? Does that make sense? All right, good. Now, supplying other areas. So, as usual, other areas in the hospital, L&D, labor and delivery, ICU, emergency room department, what other necessary dermatology, ENT, orthopedic, and we send instrument to that place. And you're going to be dealing with a lot of outside or off-site clinics. That means they bring doctors' offices located in the city or in the whole in the city or other places outside of the hospital. So the people go there, get some simple procedure. You have to bring those instruments, then you have to clean, polish them, and then give it to them. All right? So you get to see a bunch of stuff. All right, case cards. Yes.
This is question.
Question. Are you asking a question?
Yes, please.
Go ahead, please.
After setting the instrument, are we supposed to stand there during the surgery, or we will leave the ward after the surgery? We will come back and sterilize, or we supposed to stand there during the surgery after setting the instrument?
So, what's your name again?
Rayana Abdullah.
Okay. Rahana Abdullah, right? Abdullah. Okay.
Yeah.
Sorry if I didn't get your name right. So you don't have to go to the OR. You don't have to go to the operating room. No.
Okay.
If you go to the operating room, who will do the work? All right. So when you pick, if you are privileged to work in a hospital where you pick the trays, the instruments for them, when you pick it, you that is the end of your job. Unless, of course, they are looking for something and the manager says, take this to room, so and so. That is when you get to go there. And even if you go there, you're not supposed to enter. You're just supposed to crack open the door and give them whatever you have been asked to send it.
Oh,
All
okay.
right?
Okay.
Yeah, so you don't go into the room.
Okay. Thank you.
You are. So that is the case card system. Let me see if I can put the cursor on the card. All right. This is the case card. It's just a metal container where you pick all the instrument that is needed for the surgeon. If you work in a hospital, that is part of your job. You got to do it. And then you have to, depending on where your central is located, sometimes if it's located in the basement and the OR is on the 5th floor, you got to take an elevator and turn it and go and push it all the way to the room, in front of the room, and leave it. So every case card will have operating room number on it. So you have to scan the room number, scan everything that you have picked, and then scan your bag. So that if you scan the wrong thing, they'll come for you. They know that it was Fatima who put it together. All right, they know that it was Mohammed who put it together. All right, so if you pick it wrong, they'll come for you. They will scream because they cannot start the case because you gave them wrong instruments. So you have to, your work is so critical that I'm telling you, if you go and you do it well, you create a good name for yourself. And then when they need help, they always come to you because they know that you give them perfect stuff. All right. So item dispensed to almost all departments. That's the focus. Major focus on servicing the OR. I told you yesterday that our main customer is the OR before any other person. The clinics, the doctor's office, the emergency, the ICU, the labor and delivery, they are all secondary to what? The OR. The OR is the main focus of central service department. All right. Then central storage and dependable supply system. So surgical supply stored in central location department. Dependable system, we saw that earlier in the first slide, that you need a system that can inform you whether inventory is going down so that you can up it to make sure you don't run into any problem. Scheduling, surgery scheduling and case card assignment. So when this case is scheduled, I explained that it generates the doctor's preference card or pick list. So some hospitals call it preference card, some hospitals call it pick list. It's the same thing. All right. Some places they call it blue card, pink card, depending. So when you go there, you will learn the terminologies that pertains to your hospital. All right. But the easier, the most commonest one is pick list of preference one card. All right. So when the schedule is done, it goes into a system. Most of the hospitals use what they call Epic. Okay, most of the New York hospitals they use what they call Epic. So once the schedule is done, it goes into Epic, and every manager or director or assistant director can see cases that are coming up. And you can click and see what trains that are needed for that case. So based on the schedule, we are able to know ahead of time that these trays are going to be needed for the cases. So we pick them at the end, and most of the time, the picking is done the evening before the day of surgery. Let's say tomorrow is Monday, right? All the cases that are our surgery that is supposed to be done tomorrow, the cases have been picked already. They were picked on Friday. Friday last week. Because over the weekend, maybe the hospital is closed or you don't have people coming in to work. If it's a hospital that you don't have workers over the weekend, it means that it should have been picked Friday. If you have weekend scheduled people, you'll be picked, and whatever is missing Friday will be completed over the weekend and then put into the rooms before 6 o'clock Monday. By Monday, 6 o'clock, all the cases should be in front of the rooms. All the trays that they need for all the surgeries should be in front of the rooms. So you can get, that is a possible question that you can get, that cases are picked, or case cards are picked or done the evening of the day before surgery. Okay, that is a possible question that you should be looking at. Now, so we use the scheduling to generate the pick list, and then we look at the pick list to build the case card. So schedule gives us the doctor's list, and the doctor's list creates the case card. Does that make sense? So it's a drop down. Schedule to doctor's preference to case card. Are we on the same page? All right. Gathering instruments and supplies involves collecting all necessary surgical instruments and supplies based on procedure-specific requirement. Explained. I did explain that. Supply other areas. We saw that earlier, right? Topic, don't sleep. You're tired, right? Thorough knowledge of items. Understand the purpose and proper use of each item in the inventory. Know the exact storage location of every item in the facility. The first point is good, but trust me, you will not be able to know everything. I have been in this industry for I think 30, 40, right? 40 years, almost 30 to 40 years. I don't know everything. I know a lot. I'm not going to say I don't know anything. I know a lot, but I don't know everything. And depending on the hospital, you will not be exposed to a whole lot, because if the hospital is not big and has a lot of gadgets, you will only be limited to what you have. If you go to another place where you have more than what you have to learn. That is why when you have 50 years experience in one hospital, when you switch another hospital, you got to go through training, because what you know from the other side may not be the same thing that they do over there. The basics are going to say, then the machinery and your equipment that they're dealing with will be different. So you will know some, you don't know everything. Know the exact storage location. Yes, because the storage location is like your living room. So you should know every corner of your living room. You are the one who put the tray there. So if they say that we're looking for food tray, you know where you can find food tray in your storeroom. If I come, your name again? Karim. Yes, Karim. Oh, now I won't forget your name. I had a friend from Karim. So Karim, if I come to your room, your house, and I'm looking for the remote, and I ask you, you know where to go and find the remote, because you know where you're going to the remote. That's how it is. If I say, oh, wait, you said I should take your car. Where's the car key? I can't find the car key. You know where the car key is. That's how you should know where your instruments are located in the room. That's why if the OR comes and they say, can you help me find this? And you say you don't know, you look what? You're stupid. Your own room, you don't know, your own house, you don't know. No, you're not a serious person. Right. Inventory control and supply, effective management inventory levels to ensure, so system will tell you, you have to, sometimes you don't have any system, you have to use physical eye. You will have to keep on top of the situation. Every day you come, you go to the supply room and check. Are we running low on this? Are we running low on this one? Keep the numbers, tell the manager, and then the manager will place order. So that at any given time, you have the supplies to run the department without any problem. Right? Okay. Surgical specialties and procedures. You must possess knowledge of various surgical specialties and instruments they require. So in surgery, Surgery is divided to, you see the human body. That's how the services are called. Head and neck. Okay. This one. Spine. That's another service. Hand. Hip. Knee. Ortho. Alright? Then the reproductive organ and the rest is falls under GU and the rest. Okay? General surgery will be inside. Okay? Hernia. So those are the services. Head and neck. And then even the head and neck, they have sinus, which is just the nose. Have the ear, they have the eyes. This country is wonderful. You forgot? I don't know, Mom, which country coming from? Bangladesh. Good. You know, Ghana, a doctor is everything. He knows everything. It's not like here. Here, the doctors specialize.
Yes.
You cannot be Mr. Know-it-all. But back home, everybody, he knows everything from your teeth to your foot, your nail, your foot. Come on. Yeah. So you go and he's doing guesswork. He's trying to guess what's your. I don't know what about your country. Is it like that? No. So you have specializations. Yeah. Now Ghana is coming. Yeah, it's improving. Yeah, people are now specializing. They go outside, learn specific stuff, and then before it used to be your doctor is kind of a small god. He knows everything about your body. Yeah. But America is not like that. We have people go to learn specific parts of the body so that they become master of that area. And that is what they do. That's why this place, everybody has a job. Because one person cannot do it all. That's how it is. Right. So we use that you have to know specialty instruments. So you have to know spine instrument, you have to know auto instrument, head and neck, ear, eye, dental, all those instruments. You see all of them. Some of them very difficult. I won't lie to you. Dental, eye, ear, very difficult. The general surgery is the easiest. These ones are the simple ones. These ones, I'm telling you, if you go and you are serious within 3 months, you know everything that is lying. But the dental ones are a little bit. All right. Understand the specific requirements of different surgical procedures. So we'll get to know that and maybe in this next topic. Follow guidelines of sterile storage and handling requirements. Follow guidelines for proper storage conditions and handling of sterile supplies. Maintaining sterility. Yes. So you cannot, if it's a wrap tray, the wrap is protecting the content. So you don't dry, you don't pull, you lift. Because when you pull, it's going to punch out holes. And once holes are punched, that's it. That's what we call event related. You have caused a cut, you have caused an opening. That opening will allow microbacteria or viruses to enter and contaminate the content that's in there. But you will not be able to see it. You think, oh no, it's just a small hole, that's what happened. No. It doesn't work that way in medical. Once there's an opening, when they cases and they open for surgery, this is filtered. They lift it like this. If they see a small hole, not good. They throw that, they will take the whole tray out and go and bring another one. So imagine, so when you are doing it and you are going to put this on this closet, you also have to look to make sure that there's no hole. Because that filter could be defective from what? The manufacturer. And if you put it there, you end up creating more work for yourself and your friends or your colleagues. All right? Computer system related to inventory. So use inventory management software and electronic tracking system to monitor, update, and manage your stuff. So they have some system, like I told you, that we can use. it's not every hospital. So some places you have to do it manually. All right. Good. Our online friends, are you with us? All right, let's go.
Yeah, we're here.
Okay, good. Processing cycle. So items are processed after use, and where do they have to go? When items are used, where do they have to go? Decontamination room. So that's why you see the decontamination area initiates the cycle. So the cycle is from use, it goes to a decontamination room. And we say it's a one-way flow. It's a one-way flow. My friends, don't forget that. It could be an exam question. One-way flow, one-way traffic. If you go and make it two-way, you're going to cause accidents. So decontamination area is where you start. So you, at that place, you go to do inspection of each one step. So inspection of each step, ensure items are clean and in good one, repair or condition. Processing. Check packaging materials for what? Damage. All right. That's the inspection part. Skills required. Master specific skills in each work area. So decontamination, you have to open up the instrument, you have to sort them, you have to flush them. Every area has a skill. Open the instruments. Why do we have to open the instruments? So that you'll be washed properly. The instruments that have movements, that have holes in them, you have to brush them, you have to flush them. All right? So that whatever is stuck in there can get out. Okay? If you don't do that, you're going to kill somebody. You're going to infect somebody. All right? So you need this. And there are a lot of new technologies like those instruments that have holes. We call them lumens or instruments with channels. We have a scope that we call borescope that you can use to visualize, to see whether the inside is clean. Okay, so the processing cycle starts from decontain. You have to inspect, you have to sort out, you have to open, you have to flush, you have to brush. All of that is your skill. Clear? Adhere to regulations, standards, and what? Best practices. Wear PPE so that you protect yourself and do the correct job and protect your friends in the clean side or the other side. What happens if you're not well protected, gowned the way you're supposed to dress? You want to cut corners because you don't want the water, the dirty water to spill on your body. So, spraying it hard, spray it slow because you don't want it to splash on your face. But if you were properly dressed, okay, because when it splash, it's not going to touch your body, it's going to remain on those fluid-resistant gowns, face masks, and the rest. Right? So those are the regulations and the standards you have to obey. Tasks performed by CSPD or CS technicians. I don't know whether you can see this properly on the screen, but you get an opportunity to see it in your manuals. These are a lot of machineries that we use or equipment that we use in the. Let me see if I can identify most of them. Okay. Some of them I'll be able to identify, some of them I will not be able, I'm not too sure. Okay, let me see. This is a sink, right? This is a sink. So definitely a sink is for soaking, okay? For items. Let me see. This is testing something. I can't see it properly. It's testing something. So it's connecting something to test a device. And maybe some installation.
Is it not a tray?
No. Hold on, one second. It's testing an instrument. I'm not very sure. Maybe a laparoscopic instrument. It's testing to see whether there are breakages in the insulation. I'm not too sure, but hopefully it is what it is. Let me see. This is some kind of machine for processing what scopes that I can identify. All right. This is just a computer, maybe a workstation that somebody will have to work with. If I'm not mistaken, this is scope. It's holding a scope. It's checking something with the scope. All right. He's scanning a tray. All right. Yesterday we saw this one. What is he doing? He's wrapping. Thank you. He's wrapping a tray. This one, yeah. Okay. This one, what is he doing? The one the Kesa is on. He's assembling the instruments. Yeah, he's assembling the instrument. What about this one?
He's scanning the
No, this one. I'm not seeing the picture too well, but it looks like he's incubating something. I'm not sure. Maybe he's incubating some biologicals. It looks like he's incubating a biological. Not very sure. It's not too clear. But what that we are trying to say here is that in the department, you have different tasks that you have to perform. Okay, you check, inspect, check some instruments. Some of them you have to look at the light. Some of them you have to pose them to be able to inspect them. All right, you get to know all of those details once you get to the job. That is why when you are hired, you have 90 days of what? Probation, training. When they hire you, you have 90 days. If you don't pass, capiche, you push your head out. If you are doing well, then they retain you. So at the end of the 90 days, if your work is good, they say, congratulations, you have secured your spot. If your work is not good, they say, we are sorry, Mr. So-and-so, Mr. A, Mr. B, we cannot console with you. We have to go and find another job. All right? So technicians must master specific skills in each work area and learn new skills as new technologies and regulation standards come up. Okay, when new technologies come up, you have to learn. So that is why when you get to the job place, we have what we call every year you have to satisfy or recertify your certificate. You do what we call continuous education. They give you points, 12 points every year to get your certificate recertified. Other than that, it will expire. That's it. You're out of job. Technicians must adapt to these changes. And I know people don't like changes. So when changes come, it's difficult. One change has come and everyone is crying. Trump has come and the whole place is that change is too wicked, right? Yeah. So, but sometimes some people don't want to accept change. They just want to do the old way. Okay. Don't be that person because you can get yourself in trouble. Because when they press the manager's neck, he's going to come and press your neck too. So when change comes, accept it, see what you can learn out of it, ask your colleagues for help, get adapted quickly, and move on. Because you need a job to feed your family, right? Good. Examples of routine skills are what we have seen there. These are the tasks that you'll be doing in CSPD. Basic educational foundations. Basic educational foundation, reading and writing. You need that. You need that. Everybody knows you have to be able to read, you have to be able to write. Because you need, when the machine is done, you have to read the receipts. You have to read the values of the temperature, you have to read the value of the time, you have to read the value of the pressure, all of that you need. You need some numbers. What is the cycle number? Your manager is asking you what is the cycle number and you are scratching your head. You should be able to read from the paper. Right. Reports, manuals, instructions. What did you say is the manual and CSPD? We mentioned it yesterday. The CSPD, there's one word you hear all the time. The manual, everything that counts, it has something. I mentioned it yesterday.
That direction, right?
I use it. I compared it with your TV manual.
Yeah.
And then I said we have a name.
You use it to.
Pick list.
No.
Pick list.
No. It's called. I'll give you one clue. It starts with I.
Information for use.
Information for use. IFU. Information for use. Information for use. Every item has that information for use. Everything that comes to CSPD has that. If you open every box, you see the paper inside, telling you information for use. IFU. Giving you instruction how to treat it, how to handle it, how to process it, how to clean it. It will be there. So you need to be able to read that. Communication skills. We mentioned yesterday that if you are not able to communicate to your colleagues, you are going to create what? Chaos in the department. When you are leaving, let's say you are about to leave, 3 o'clock, your shift ends 3 o'clock, you are about to leave. They gave you, they told you that they need a tray to be quickly turned over for a case at what? 4:30. You did the tray. You did it, right? You did not tell the person cooking or sterilizing that, hey, Mohammed, I'm done with the tray. They need it at 4:30. I'm going home, so make sure you push it to the next load. If you don't talk, Mohammed doesn't know. He cannot read your mind. So you need to communicate. If Mohammed doesn't do it, he comes. He says, why is it not? It's still, they come 4:30, the tray is still sitting down and cooked. What do you think is going to happen? The doctor will start screaming at the nurse. The nurse will start screaming at your manager. All right. So it's technical interpretation, understanding technical materials for CS practices and what procedures. So you have to do a lot of what reading. Okay. Some of the things you have to ask. Some of the things you read and then you proceed. Microbial transmission and infection prevention. Understand concept of microbial transmission, which we'll be looking at later. In I think chapter 3 or chapter 4, you look at how macros are transferred from one point to another. You see that. All right. You have to know it. That is the way you will be able to apply the knowledge to it in clinic. Then medical and surgical technologies, which we shall be looking at shortly. Computer system related to it. We'll get to know that. We'll see that along the line. I don't want to offload everything. Now, what are the basic knowledge and skills that you need to function? These are the knowledge. You have to be able to communicate, verbal and in writing. Okay, talk and then write. You know that some people cannot write. Some people get tense, they can't even write. They forget even how to spell the word is. It happens when you're under pressure. In the examination. Yeah. So evaluate how well others understand you. So sometimes you come, like some of us, when we came here the first time, water. How many of you experience that? Unless it's employed. You speak, and your friend said, huh? It's busy, they don't understand what you said. So you have to try to properlize yourself. Try to come to I mean, try to pick the accent. You are forced to, because if not, they keep saying, huh? What is going to happen? You're going to say that when you speak, they don't understand. They start complaining. So you begin to, so when they say, you ask yourself, how different would I have said it for them to understand? Then you say it that way next time. And then maybe they will not say anymore. They will get better. I have a friend, I'm sorry, how many Jamaicans are here? How many Jamaicans are on the line? I have a Jamaican friend. Touch the item. I don't know what she's talking about. I wanted to say yes. I don't understand no way. Strong one. So that's how it is. But I was able to survive because I never told her I didn't understand. But I never told her I didn't understand. Yes, no. Whether the answer is supposed to be yes, or I'll say no, I don't know. Sometimes she'll get to know that I don't understand what she means, and then she'll come and point what she wants. And I say, oh, okay, so there we go. Right. So you have to be able to communicate. And every continent, they have their own way of speaking. Even the United States, somebody from New York speaks different from somebody from Tennessee. Somebody from Tennessee speaks different from somebody from California. Adjust your communication techniques to ensure effective interaction. Listen to people. I have a worker. He will never let you finish your sentence. He already knows what you're going to say, but he get it wrong. Okay, so listen to your people. Respect. Show respect and professionalism when working with people from diverse backgrounds. Yes, very important. Diversity, very, very important. Don't downgrade someone. The way they just follow this photo, what do they call it? What is this expression of time? When you want to be right, they respect. So if you have a culture and you want your culture to be respected, you have to respect other people's culture. All right? Don't superimpose your culture on other people. All right? So when you go there, you find all shades of what people. Yours is to do your 7.5 hours and go. Accommodate the person's culture, accommodate the person's behavior. Once his behavior is not breaking the law, it's not infringing on your liberty, case closed. Do your job, get out, go. Clear? Yeah. All right. So speak and write clearly. I cannot overemphasize that. Follow the communication protocols specific to your facility. So if the chain of command is that when somebody does something to you, you report to your manager, don't go and fight. Talk to your manager. Hey, manager, this person disrespected me. Can you look into the matter? That's the man of the case. Don't go and fight. If you fight, you're fired. The day you go and fight, throw this one, you're out. Trust me, there is nothing that will stop. Even if your case is like the Ghanaians always say, even if your case is sweet, they walk it out. Know that it's done. Once you are the first person to throw, you're out. If both of you threw, both of you are out. So restrain yourself and don't do it. Because when you do that, it will take you a while before you get a job. Because if you go to your next job, they might call the other job to take reference. What do you think they're going to say? It's a kickboxer. All right, good. Facility system. Understand your specific responsibility and how your role fits within the department overall. So you have to know where your limit ends. You have to know what you can do in the hospital. And reliability skill, demonstrate professional behavior, reliability, and readiness for workplace. So demonstrate that you are professional, you can be dependent on, they can rely on you to get the work done. Okay, don't show up to work late. Don't be calling out. All right, those are them. When you go for interview, they ask you all these questions. Your last job, how many times were you late? You'll be surprised to hear that of those questions. All right, and how many times did you call out sick last year in your other job? If you give them a high figure, what do you think is going to happen? Okay, if I give you high, he's going to be calling out. So say, why? I'm not going to. They will not tell you. So that is that. Legal responsibility, comply with laws, regulations, and specific facility policies to ensure safety, accountability in all work activities. So there are laws, the hospitals are under federal laws and state laws. Those laws are supposed to be respected by you too, because the hospital authorities hired you. If they are obeying it, how can you break it? If you break it, you put them in jeopardy. That's a lawsuit, and what is going to happen? They also hold you accountable. So you have to respect all laws and regulations that run over there. Effective communication methods. Use alternative. Oh, is that what you just said? Okay. Now let's go to assessing understanding. Evaluate how others understand. We saw that. Adapting communication style. Same thing. You got to listen to others, pay respect to other people's background. Active listening is important to listen. You have 2 years for a reason. Everybody has 2 years for a reason. You're supposed to listen. Listen to your colleagues. Don't be this know-it-all. You will not be able to know everything that everybody knows. You'll be strong in certain areas. There will be one day you will lack something. And you'll be short, something simple that you don't know. All right? So it's a teamwork. Rely on other people to get your stuff done. Today's Tawfiq is struggling to keep his eye open. Respectful interaction. Engage with colleagues and patients in a respectful and professional manner at all times. Straightforward communication. Communicate information clearly, concisely, and without necessary facility-specific guidelines. Follow organization-approved communication channel. You cannot skip your boss and go to his boss. Okay? If you go there, his boss, if he's doing the right thing, he will ask you, did you talk to your boss? Once he's done, he asks you that question, what your face will what? Change. Means you look stupid, you didn't do the right thing. Right? So channel communication, very important. Electronic information access. Properly access, interpret and use electronic communication system and data within the facility. So you cannot go and be accessing patient information. You can't do that. But you can use the hospital computers to do your work-related, your assignments that you are assigned to do in the hospital. Anything apart from that, no. Okay? Don't go and check whether somebody has diabetes or gonorrhea or whatever. It's not your job. You're not a doctor. That's why when you get anything that has patient information, you have to put it in a shredder. Okay? You don't have to. And you get to see that when you are working in decontent, sometimes patient information makes its way to decontent. Once you get that, you got to call somebody, give it out, and then they put it inside the shredder so that it's a company that comes to take it out and go and shred it so that information doesn't go out. So your role as a technician, understand the role within the department, recognize your impact in the overall healthcare needs. It means your role is very important. Key services, awareness of the range of services offered to customers. We have seen that you distribute, you prep, you clean, you prep, you sterilize, you distribute. Your range is wide. quality improvement, participating in quality improvement activities and preventing unnecessary waste and what? Duplication. So you always have to strive to make sure that if you do something, you gotta try to perfect it. Okay, try to perfect it. If you get called for a mistake, you make sure that for the next 6 months or a year, you're not called for that same mistake. It means that you are improving, you are learning. But if you they call you today, and 2 weeks later, same problem, 3 weeks after that, you are being called for the same problem, you are asking a question. Okay. Then it means that you are just not listening. You be a problem employee. You don't want to be like that, right? Important. Utilizing resources. Using resources such as staff members, manuals, and training work opportunities. So we always have training, which we call e-services. Sometimes the training is go and read something on the computer and then sign off that you read it. So you have the knowledge. Sometimes some certain things are just passing of information and then we go to do. Right, employability skills. Demonstrate strong attendance. Yeah, very important. Take personal responsibility for one's action and performance. Yes, don't say it wasn't me. Meanwhile, your name is on it. Have you had kids in the house? Something is missing. The thing is, the child is holding the thing. Say, no, it wasn't me. It's in your hand, but you are saying that it's not you. So who is it? So these things happen. Professional conduct standard. Follow established ethical and behavior expectation within the workplace. So do not fight. I said that. Using analytical skills. Apply logical thinking and problem solving strategies to evaluate information. So sometimes you get information, you have to think outside of the box. All right? Sit down, meditate, and see if you can get something to work with. 1 second, guys. Sorry, I need to. Yep. So sometimes you need to use this one. Brain. Subject your brain to some logical thinking. Then formulating solutions. Once you subject your brain to some thinking, you get solutions. All right. Sometimes your manager is even trying to figure out how to fix the problem. You are not a manager, but you can provide a solution. What happens if your manager, you are able to solve your manager's bigger problem? What do you think is going to happen? You're going to be on his good books, right? When there's OT, who is he going to call? You see, that's how it is. So, adapting to change. Everybody should be able to adapt to change. All right, change is difficult. Some people don't like change, but you have to be able to adapt. Demonstrate ethical behavior and transparency in your professional activities. Continuous self-assessment. Regularly reflect on performance to identify areas for growth and improvement. We saw that. Make sure that if your filter, you miss a filter, the next time you will not miss it. Exhibiting respectful behavior. Treat others with dignity and professionalism in all workplace interaction. Respect others. Yeah. Listening attentively. We saw that. Understanding career options. Explore various roles and advancement within the profession. When you get there, you see there's a career ladder that you can climb. For certified registered central service technician, you can go to become certified instrument specialist. You can move there to a higher level, okay, and all comes with a lot of knowledge. And then with that, you can go and apply for some managerial positions, okay? But you need other qualities to be able to get to the top as well. Legal responsibility, understanding legal responsibilities. Stay informed about your legal responsibilities and any limitation related to your role. I told you, you cannot go and access patient information. That is not your job. You do that, they fire you. There's no way we can survive. So know that. Problem solving. Using critical thinking to solve that. That's the analytical part. Risk management. Take steps to minimize risk and ensure safe practices for patients and staff. So if you see there's water on the floor, what do? You put a signature there that sweats so that people get there, they know how to walk. All right. You saw water in the department, you didn't do that. Somebody fall, you break the hip. What is going to happen? You're going to sue the hospital, right? You could have done save the situation. Incident reporting. Accurately report incident, errors, or unusual events in compliance with facility policies. So yes, if you do the work and you hurt yourself, you need to report. Then we make a what do you call it? Occurrence report. Okay, we do the occurrence report so that we know that this is what happens, so that we can educate people, so that nobody gets hurt in that way. All right. People want to get hurt so that they can go and sue the hospital and get some money. Confidentiality, protect patient information. So that scope of practice, perform duties only within the limits of your certification, training, and legal authority. If you go and do something that is beyond your job description and something goes wrong, you are on your own. Yes, when you get there, they will tell you. When you get to the hospital where you're going to be working, you know where your scope of operation ends. Okay? Let's say there is flooding. One of the pipes in the department burst, and the water is gushing out. You are not a plumber. You have not been trained to be a plumber. And you go and do something and you get hurt. Okay, thank you. Or you want the water. Sorry. Yeah. So you go try to do it and you get hurt. And you want to sue the hospital. They will ask you, bring us your plumbing certificate. You don't have case codes. Keep quiet. So don't do anything that is not within your scope. Which one are we talking about? Employment laws. Understand your rights. That's what we got, including wage responsibility as an employee, including wage, labor, and anti-discrimination laws. You need to do that. Okay. You can't just wake up one day and say, "Hey, manager, I need to increase my salary." It doesn't work that way. You probably will belong to a union. The union is the one that has to go and negotiate for you, right? And then documentation, complete, accurate, and timely documentation of procedure, incidents, and other relevant records. So if you get hurt, you have to document the time, where it happened, how you are hurt, what did you do to get hurt. All of that you need to know. Maybe you got hurt when the manager was not there. You need to get somebody to witness that you are hurt. All right? Because sometimes people want easy way to make money, where they will intentionally go and pour the water down there and then go and sleep and fall and then want to sue the hospital for more money. No, we don't do that. Ethics. Knowing the difference between right and wrong is ethics. That's the definition of ethics. You know what is right and wrong. Then conforming to accepted and professional standards of conduct. You go, you're reporting to work at 3 o'clock, you go, some people are there. Hello, everyone. You don't lose anything. You greet them. Go, do your work. Okay? Good night, fellows. You don't lose anything, right? Stay at peace or be at peace with everybody. Guiding principle, respect patients' rights. Yes. If you go, sometimes when you are when you are running, you are going to work, and the patient is about to enter the elevator, let the patient stay. All right. Sometimes that you may be late, but what can you do? Right? You can at that time the patient is on top. Promote justice and equal treatment. Treat everybody the same. Prioritize patient needs. Put patient needs above your personal needs. Exhibit loyalty to fellow workers and healthcare facilities. Don't lie to your friends. Be open with them. Okay? So that they also be open. Report activities affecting health, safety, or welfare. If you see your friend, sometimes they are struggling, you see that they are going through something, you have a nice way of trying to see if you can help. All right, looking after each other's welfare, important. If you try to help and say, why are you being nosy? Okay, then you just step back. Okay, or if you cannot do it yourself, you can just tell the manager, say, hey, manager, I've noticed that so and so is going through something. Can you step in and find out if you can help? All right. And we have other resources in the hospital that the manager can reach out and assist that colleague of yours. Respect interdisciplinary differences. That's the cultures we were talking about. Differentiate between ethical and legal issues. Yes, ethical and legal. Something may be ethical, but it's not legal. Okay, all right, very important. Safety practices. Consistently follow established infection control protocols. Hand hygiene, we saw that yesterday. Okay, hand hygiene, you always have to wash your hand when you get to the hospital. You wear PPE. Every job has its way of dressing. Okay, if you see a police officer, nobody will tell you this is a police officer. If you see a construction worker, you see some hard hat with paint all over his, or cement all over his clothes. All right. If you see MTA worker, you know that is an MTA worker, right? If you see a doctor working in the street, you know. Yeah. You see a telescope on his neck, bam. And that's how it is. So if you come to our department, you will see us too with this one. Yeah. Working with it. Yeah. Okay, very important. Everybody, so you have to dress and take care of your hygiene. No, we talked about jewelries yesterday, no wearing long, the artificial nails, long hair, strong perfumes, all of that, put them aside, okay? My wedding ring, I've not been wearing my wedding ring, I can't remember the last time. Because they don't want us to wear them in the department. Because that will fall into a tree. It can also harbor microbacteria. Then body mechanics. You have a way to lift items that are heavy, okay? If you want to lift something that is heavy, you have to open your legs, right? So that you can have proper grounding to lift it. So that's what we call body mechanics. Economics. In the book, they will say economics. I don't know what I still there. Right. Hazards recognition. Okay, if you see hazard in the workplace, you have to report. Like you see wet floor, you have to report. Or you see water gushing out from somewhere, you have to report so that corrective actions is taken immediately. Equipment usage. Operate department equipment safely and according to the manufacturer instruction. Okay. If the sonic, the washers, the sterilizers, use them as instructed by the manufacturer. Don't go and use it another way. All right. Hazardous materials. We have a lot of chemicals in the department. So the chemicals are contained. In case of spillage, you have to report immediately so that the department that is responsible will come and take care of that. So handle, store, and dispose hazardous materials in compliance with safety and regulation. Emergency procedure. Understand and follow emergency protocols for fire, chemical spillage, power outages, or medical emergencies. They say in the hospital, they tell us that when there's fire, call 911. And me, call 911. I'm running away. I'm going to run before, if I get out before I call 911. All right. So when there's fire, chemical spillage, you got to get the authorities informed. But they have fire alarm that you could pull that it will notify the nearest fire department that hey, there's fire somewhere. All right. We're supposed to call for all these emergencies. All right. If you see somebody acting strange in the hospital, don't call excursion. Okay, and then you come and assist.
Oh, I saw something.
What do you see?
Some of the names, the acronym, like OSHA, right? What is this?
OSHA. Yesterday we talked about occupational safety, health administration. All right. We'll talk about them as in one of the chapters. Okay. We'll look at that. Yeah. So we'll look at them in some chapters. Teamwork. Everything that we are talking about is a teamwork. CSPD is teamwork. You have 3 shifts depending on the hospital: morning shift, evening shift, overnight shift. You have to be able to communicate. Morning shift, you have to be able to pass on information to the evening shift. Then the evening shift will pass on the information. Whatever they are not able to fill in, you have to pass that to the overnight shift. Then the overnight shift, whatever you are not able to finish, when the morning shift comes the next morning, you give them the information. That's why communication is important. So it's all about that. All that we have been talking is about teamwork. All this what we are seeing about it is about teamwork. Resource management. Effective resource management controls costs. So if you manage resources well, you reduce what? Costs and wastes. Okay. Provide quality what? Service. Because you never run short of what? Resources. So there will be flow of what? Service, uninterrupted flow of what? Service. Okay. What will happen if patient is scheduled for surgery? They come, the trays are not ready. They cancel the case. The patient didn't eat the day before, and they cancel the case. Well, what will be the experience of this patient? It's going to give you, if it's cancer rating, it's going to give you poor rating. And it's going to tell his family members, this hospital, if you go, you're not likely to cancel your case. So what's going to happen? His friends, his family members will come. The hospital is going to be losing money. Practice time management skills. You got to practice time management. Identify and solve potential problems. Anticipate customers' needs. You got to think for the customer and fix or meet their needs. Practice recycling and sustainability. Other essential skills that you need is healthcare associated with infection. Healthcare associated with infection is you don't have, let's say, I'm just using a hypothetical as example. You are sick of what? Let's say you are sick of, you have a flu, you go to the hospital, and by the time you leave the hospital, you have, what kind of disease? Diarrhea. So you got the diarrhea from the hospital. That's what you mean by healthcare associated with infection. You got infected in the hospital. And what will happen before you get infected? It means that the place is not clean, it's not tidy, it's not in the best of shape. Maintain departmental work areas clean. All right. Our department is supposed to be the most cleanest. It's supposed to be the place that is very, very clean. But you will tell me whether it's clean or not when you get there. Job responsibilities, job description. Define, tells you what you're supposed to do. All right, that's job description. That is what, when they give you they hire you, they give you the email, they tell you all the things that you're supposed to do. Lift 50 pounds, push and pull, all of that. All right, that is your job description. You don't go beyond that. All right. Good. Determine compensation. That is evaluation position determines your compensation, your pay. Tell you that. All right. Establish pay range. Then clarify expectation. Outline key job duties. But you know what? There's always one sentence in there that can include everything that you can think of under the planet F. They say, and any other related matter. And any other related responsibility. That line can be anything. You can be even fetching water for the hospital person. All right? Yeah. You always see that part of the job description that they list there. Review performance or clarify. Okay. Clarify performance standards and expectation. Review regularly by supervisors and employees. Then review performance used during annual performance appraisal. So we at the last point, review performance. The manager, that's the manager's job. At the end of the year, we have to look at everybody and say, hey, Mr. A is an 80% employee, Mr. B is 70, Mr. C is a what? 90%. So whatever you are doing, the manager is watching, he's paying attention. Okay. Are you coming to work early? When you come to work, are you focused on your job, or you're always on YouTube or TikToking or watching videos, watching movies? What happens if you are watching movie and you are doing trade? You put something that is not supposed to go in there, right? Career growth and profession. We saw that when you enter in there, there's a pathway to get to the top. Okay, but you need the basic one to start with. When you get there are multiple places that you can go. All right, and it all depends on your motivation. Some people go there, they say, I'm good, I'll retire here. That's cool. Some people go there, they say, no, I don't want to be a tech for the rest of my life. They take whatever they're doing serious, and then they can become a manager, you can become a director one day. That gets me. So if you, like we saw yesterday, I'll go to nursing school out of that and become a nurse. And once you are in the hospital and you go for further studies within the health system, you don't have to go and apply. You just be waiting for there's a job opening somewhere, they just switch you. That's it. They consider you first before considering somebody from outside. Right? So we have a career ladder that we can grow. Compensations. The factors they use to compensate is the job description, the size of the facility, the organizational structure, the job market conditions, the geographical location. Yes, our job here, the job in New York is paying than the same job you do in Connecticut, you don't get paid more like you get paid here because the cost of living here is like high. All right, so you get people stay in New Jersey and they work here. You get people stay in Connecticut and Pennsylvania, they work here because they make more money. All right, so all of that factor in. Head of department compensation. Do you need that? Okay, maybe one day you become that. CS director should be fairly compensated relative to peers. So definitely, if your your manager should get more pay than you, right? There's no way you take more money than your boss, right? Then trends in compensation, pay increment based on experience. Some places you go, you tell them you have a certain number of years of experience, they give you more money. But if you go and lie, it will show, right? When they expect you to know something based on your experience, you told them you don't know, what happens? Yeah. High performance recognition. I want to see if we can finish this before. In conclusion, right? So all that we're doing is the concluding part of it is that we're trying to look at a dynamic and fast-paced environment. Things are changing so quickly, so we too have to change. Trust me, when I took this course, the book was different. Trust me. This book is fatter than my book that I use. This is 9th edition. I use 7th edition to do it. So 8th edition has come to pass. 9th edition is the system. And these editions don't come, it's not this. It takes like maybe 5-6 years before they review the book. All right? So they have done 2 reviews. That's why you have. When you get into the job, 5-6 years time, 5 to 10 years, the book will not be the same. You see different items coming in because things are happening so quickly. So work in challenging, highly technical and complex situations. That's why we are here. Major impact on successful operation of many departments. Costly inefficiencies, errors, and poor quality performance are costly to the hospital. So we try to avoid that. CS professionals must conserve resources and minimize expenses. And then patient safety is also important. That is key. You always have to remember that the patients need to be safe, meaning that your instrument has to work clean, very, very clean. Put yourself in the position of the patient. You are the one lying down there. They are going to dissect you with dirty instrument. How do you feel if you get to know that the item they used on you were dirty? You will feel bad. It's a bad experience. Nobody should do that or go through that. Negligence and cleanliness and CS will cause a patient life. You have seen that. Then, if involving occupational discipline, dramatic changes in technology, support services, job skills, training, and educational requirement. We need all of that to be able to fit into this fast-paced situation we have. Changes continue at a rapid pace. Every day, something new is happening in the healthcare system. Something new is happening every day. People are not sleeping. People are inventing stuff. The medical field is fast-paced. I was telling you, now people do surgery and then you can't see that they have done surgery. Everything looks like organic, the way God created them. There's satisfaction and conscientious professionals. So you do it and you do it well, you get certified, and then the pay that they give you, you are content, you are very happy. Okay, sometimes you do the work and you go home, you have a peace of mind, you know that you did your possible best. So always go there, give up your best, go home and be happy with your family. All right? Any questions so far? I forgot about my online friends. Are we there?
We are there.
Yeah, we're still here.
Okay. So let's go for a break and come back at 5. All right? Stretch, and then we come back at 5 o'clock. Okay?